Today is World TB Day, and PAHO WHO is promoting the End TB strategy as an integrated part of the SDG 3 on global health. Let's unite to end TB, leaving no one behind. And leaving no one behind, incidentally, is also one of the sayings that we have in the government manifesto, leaving no one behind. An estimated 50,000 people in the Americas have TB, but do not know that they do have that. And Guyana is not an exception. And the government of Guyana, Ministry of Public Health, have included this in the National Strategic Plan 2015-2020. This action is a priority. The End TB strategy was approved by the World Health Assembly in May 2014, after an in-depth evaluation of the trends in morbidity and mortality achieved from the MDGs from 2000 to 2015. And this raised the bar for the SDG, with challenging indicators to be reached for 2030 and 2035 with the End TB strategy. That means if we are looking forward to end TB between 2030 and 2035, that means we virtually have how many years? We are in 2017. To 2027 is 10 years. To 2030 is 13 years. 13 years is not a lot of time. The paradigm of the SDG era for 2030 is based on integrated, indivisible SDGs, multidisciplinary, and equity as its focus. Placing at the center all people who are vulnerable to or are affected by TB. Incidentally, this issue, placing at the center all people who are vulnerable to or are affected by TB, I keep saying that persons who have TB and persons who are affected or concerned about TB, we are not as vocal as persons who are infected or affected by HIV. So when you talk about having people to meet, when it's HIV, you have a lot of people. When it's TB or malaria, you hardly have anyone. Ladies and gentlemen, if we are serious in terms of ending TB by 2030, then we all have to be involved.
So as we can see, we have regions 4 with the highest burden, and that being the central region, the city. We don't have any explanation for that. We all know why we have the highest burden in regions 4, followed by regions 3, regions 6, and region 10. Next, this other slide basically shows the dots coverage throughout the regions, and we can see in regions 5, regions 10, and the prison we have 100% of dots coverage, followed by regions 3 98%, and regions 4 97% of coverage.
It is that time once again when the world takes a day to observe the debilitating effects of and the progress made in the realm of tuberculosis diagnosis and its effective treatment. Today, World TB Day, is being observed under the theme or caption, Unite to End TB. This theme is not only timely and relevant, but most applicable to the necessary efforts required to effectively address the issue of TB. Tuberculosis now has the infamous title of being the world's leading single infectious disease killer, a title previously held by HIV and AIDS. Therefore, the battle against tuberculosis, or TB I'll call for short, requires, as the theme implies, a concentrated, unified effort by all stakeholders in order to realize the goal of ending TB by the year 2030. Quite appropriately, therefore, World TB Day provides an excellent opportunity to raise awareness about the disease and to advocate for more strategic efforts to eliminate it. While TB incidence is decreasing globally, multi-drug resistant TB is on the rise. The fact is, one of the serious concerns because the current treatment can provide to be ineffectual once the disease mutates. To compound this problem, we find that timely identification and following the prescribed treatment plan are often issues that we grapple with in Guyana. Apart from timely TB identification and following the treatment plan, other issues such as insufficient awareness about TB among healthcare providers, social service providers, and the general population are inimical to the fight against TB. Lack of information about the prevalence of TB, the nature of the target population, and proper methods of screening, together with improper medical management of this disease, can also contribute to disease transmission. Actually, these factors contribute significantly to missed opportunities for prevention, early diagnosis and medical intervention, and poor health outcomes in infected people. The Ministry of Public Health is engaged in a series of measures to transform its whole approach to TB treatment in our public health system. Together with various local and international partners, the Ministry continues to reform our primary health care delivery, which will allow for the efficient treatment of patients in line with modern international approaches. One of the important activities the Ministry of Public Health recognizes is the collection and interpretation of data about the levels of infectious disease in the Guyanese population. The collection and interpretation of this data is an essential activity that takes place within the ministry through our TB program. Key infections, including tuberculosis, are under constant surveillance to detect significant trends, to evaluate prevention and control measures, and to alert appropriate professionals and organizations to infectious disease threats. We will continue to work assiduously to ensure that all cases of TB are offered appropriate medical treatment. Further, and very importantly, the screening of close contacts of those diagnosed with the disease will also be undertaken, and any necessary treatment or vaccination will be promptly administered. The Ministry of Public Health has partnered with key agencies over the years to expand TB services across the country, from 1 TB site in 2000 to 18 TB sites currently. Directly Observed Treatment Short Course, we call it DOTS, implementation began in 2002 with the support of CEDA-funded Public Health Strengthening in Guyana project, which saw the rolling out of DOTS to 4 regions in Guyana. The Ministry of Public Health, with the support from the Global Fund TB project, expanded the DOTS program across Guyana, thus ensuring that there are existing TB services in all of the 10 administrative regions of Guyana. The degree of success of every initiative depends largely on the ability of its human resource. As a consequence, continuous human resource capacity building through regular trainings is engaged upon to ensure that the ministry is able to offer executive health care or effective health care to all of the citizenry. The Ministry of Public Health was able to strengthen the Central or the National Tuberculosis Program, NTP, the unit, over the years with support mainly from the Global Fund. One achievement that we can boast about and must be applauded is the establishment of clinics and DOTS programs in all 6 correctional facilities across Guyana, including that's our prisons. An NTP officer provides direct supervision and support there. The NTP